Okay, I'm going to get this meeting kicked off. I appreciate you all joining us today for the Kentucky Workforce Innovation Board Partner Spotlight. And today we are happy to have Tracy Williams, who as an executive advisor is the project manager for the Connect Resources program offered through the Cabinet for Family and Health Services. So I believe I've given her co-host privileges, and she's going to be sharing with us a presentation. So Tracy, the floor is yours.
Wonderful. Thank you so much. And thank you for allowing me to be here to share the information with you about Connect Resources. I'm going to get my screen shared here, and you can see I was at the bottom of my presentation. I actually just left another. So let me get prepared here. There we go. And again, just thank you for letting me be here to talk to the group about Connect Resources. I'll talk a little bit about what our mission has been as we've put together Connect Resources, and then talk about some of the function of how it's used, and then be able to take a quick look at the system and how community organizations and other users may be navigating. So to get started, I want to talk first about our mission. So Connect Resources started really with the idea to bring together community organizations, other Commonwealth agencies, as well as CHFS into a single platform. We had conducted, in partnership with Deloitte, some human-centered design research, and that was really to help look at some enhancements we wanted to bring into the application system, et cetera. But a part of that was really talking with community partners as well as residents. And we knew that there were some other states who were successfully implementing a resource engine, which is what Connect Resources is, through their state eligibility programs, et cetera. And so, we started to look at that and how could we reduce barriers for individuals in finding help? How can we help them connect faster? And how we create a one-stop shop. So of course, under the Connect branding, we have our state-based marketplace, we have our benefits application, and then we've included Connect Resources under that Connect branding as well. So for a resident perspective, if they're coming to the state for those helps, we've been able to help give them certainly that one-stop shop, but also for community organizations and other users. We knew as a state, some of the things that would really help is to be able to bring in a closed loop referral process. So being able to have referrals that are sent to organizations and having those organizations respond to those, being able to provide the services or help direct to other services for individuals, and really focus on improving those outcomes for individuals. And again, an individual sometimes can become quite overwhelmed just looking for support in one area. Certainly whenever it comes to going to several different websites, several different categories, et cetera, we looked at ways to make that improvement, to be able to make it a little quicker for those folks as well as our community partner users. And then lastly, really being able to look at, collect some insights, look at some of the metrics that our system is able to provide, certainly with attention to social determinants of health, being able to look at, what are the popular searches, where are there gaps in service, really using that information to help inform how we plan policies, what our processes are there practices that need to be improved, and being able to use the metrics from the system to implement those as well. And as we started building this, we had some partners that really helped us get Connect Resources up and running. And we started with a partnership with United Way. So United Way 211 is really the data that we started with in Connect Resources. And United Way 211 has contact information, location, all the details about organizations and what they provide. And so we were able to really build our system based on that database of 211 and being able to have over 10,000 resources that were available throughout the state. This partnership with United Way also was able to allow United Way to expand their 211 services throughout the entirety of the state. So really a good mission to be able to work together with them in partnership. We also have worked on system integration. So if someone updates their United Way 211 listing, then that gets updated in Kynect Resources and vice versa. We also were really excited to be able to bring in some of our information from our integrated eligibility and enrollment system. So with CHFS, if a resident is involved in SNP, TANF, Medicaid, or child care supports, then we have that information that we're able to share with our users. It's limited. Our users are not seeing all of a person's case information in our eligibility system, but they are able to see some information about household and composition and those enrolled programs. And I'll give you an example of why that was important. There were certainly programs for utility supports or other programs that may utilize enrollment in one of those programs as an eligibility factor. And this gives them a way to, those organizations, a way to see that enrollment without having to add additional steps, again, connecting faster. We've also worked with the Kentucky Health Information Exchange, where we're sharing social determinant of health information between Kynect Resources and KHI. So as an example, KHI may receive social determinant of health information from provider offices, and that information is populated within Kynect Resources. Kynect Resources has an assessment that matches the social determinant of health categories for KHI. So we're able to send that back. So if a user has updated that information through an assessment in Kynect Resources, we're able to share that with KHI so that that system has the most up-to-date record, as well as if they're sharing with us, someone who maybe has never logged into Kynect Resources yet or taken an assessment, then we're able to have the most up-to-date information there as well. So those system interfaces really provided a unique resource engine to be able to really serve. And so I want to talk a little bit about who all of our stakeholders are. Front and center, top and center here are our residents. Certainly being able to give them the ability to go into a single location to look for supports in their community, being able to share some of those resources with family and friends via text or email, being able to have a login ability to create a plan, to be able to take the assessment themselves, being able to connect directly with organizations. So if I'm a resident and I'm using Kynect Resources and I'm logged in, I'm able to connect to an organization that I may need their services. And our system is going to send an email to that organization saying, Tracy Williams needs your help. And it gives them the ability to respond. And so community partners is another stakeholder. Again, their community partner organizations offer all kinds of different services throughout Kentucky, but Kynect Resources offer them some tools to really manage the referral activity, whether that's incoming or outgoing. It gives them some tools to track the metrics of that activity. And then, of course, being able to interact with residents that they're working with to create referrals on their behalf, take assessments on their behalf, etc. We also, with our Department for Community-Based Services staff, they too have a role within Kynect Resources, being able to, as they're working with individuals through their programs and hearing maybe about other needs, being able to use their system to link over to Kynect Resources to be able to provide referrals to other organizations or programs that may be beneficial. I'd mentioned the KHI integration, and again, the provider offices being able to use Kynect Resources as a place to view and generate the social determinant of health information. And then, of course, also helping patients being able to connect to those supports in the community. And I have state agencies listed here. So there are several. Within CHFS, we have our Frisky offices. Within KWIB, you may, obviously with the career centers. So definitely different state agencies have the ability to have a role within Kynect Resources to help further support the residents that they're working with that may fall outside or in support of the programs they're offering. So, of course, being able to find those referrals, being able to use the system, create outgoing referrals, and even receiving referrals. and that assessment is available to them as well. We also have a group called connectors, and connectors are very important to our Kentucky residents as far as helping them through their health coverage applications. They're able to also work one-on-one with these individuals, hear their needs, be able to use Kynect resources with their unique role within the system to be able to create referrals and help further improve their outcomes. And then, of course, I'll also mention United Way, our partners in being able to help maintain the database, being able to work with community organizations, and partner with us in our outreach. And this is what Kynect Resources website looks like. So just a couple of points about this slide is we really, again, trying to make it very easy for those individuals rather than having to go and look at different categories of need. We kind of packaged several. So if I'm unemployed, I can go to this here in the center top, the unemployed archetype, and be able to have a curated list of resources that are available to me that may be relevant because I'm unemployed. So it may be some of those job support services, it may be resume writing services, but it may also be healthcare. So if I've become unemployed, I may have lost my health coverage. If I am unemployed, I may need help with rent assistance. And so those types of resources are going to be listed within that search. Of course, there's the traditional searches as well, whether it's by category or keyword. But a couple things to point out. So certainly with our website traffic that we're able to look at, we have a lot of residents who do come to our site and use the site as a quick directory, and many are logging in. One thing to point out with Kynect and having the Kynect benefits and the Kynect health coverage, all within that brand, there are so many that do utilize their login. So if they have Kynect credentials, it's a COG account, Kentucky Online Gateway, they are logging in, they are creating referrals. And I'll share some of those numbers with you in a moment. But you can also see our community partners also start from this page. In our community partners, we have 337 who've completed their onboarding. I'll talk about that process in just a moment. The 337 community partners, many with multiple staff members, are utilizing Kynect resources to respond and to create referrals for residents. And this is just a quick look at what that search may look like. So I can search by category, and you can see here, I've selected employment, and there's some subcategories where I can look at all of those. So depending on what my need is. And then whenever I do look at a list of results, you can see there's an entire list. I can expand that list through a drop down to give me some details about what this resource offers. And I have some contact information. So I can just call this organization. I can go to their website and look at a little bit more information, or I can use the Kynect button. And that Kynect button is going to actually create a referral in our system from that resident or community partner to that organization. Our system automatically sends an email to Bluegrass Career Services, the one selected here, that says this person needs your help. And so they can use Kynect resources to receive that in their inbox and respond. You can see where the community or the Kentucky partner banner is there above the name. That indicates that that organization has onboarded and is responding to referrals. And I mentioned the referral inbox a couple of times as we've talked about this. So as a community partner, and I really wanted to share this. So if you're a state organization, one of the career centers, one of our other state agencies, or a community partner who's using Kynect resources, when I log in, I have a workspace. And I can do a lot of different things from this workspace. I'm going to try to bring up our system demo here in just a bit to kind of go into some more details about those tools and what's possible with those. But just looking at the screenshot, you start with an inbox and you can see any of your incoming referrals. And you can see here at the bottom where my cursor is kind of circling, there is an incoming referral for this person's name. You can see what date it was made and also what resource has been requested. So this is an example again from our test environment, but also what resource and then the location and seeing the status. Is it new? Is it in progress or has it been closed? Of course, whenever there's a closed resource, we're able to track the outcome of that, whether that is if it was provided, if it was not provided, if it was not provided, what are the reasons? So a lot of tools there. You can look for a client's name. There's some specific criteria around that. I'll show you in just a moment. But when you do have the ability to connect with an individual, there is a consent process that you do have to have consent from the individual to view this information. It's a quick consent. It can be done via email, text, or verbal. So it's verbal if you're on the phone or in person. You're able to read them some statements of acceptance and then be able to verbally confirm your access. And when you have access to this record, this really kind of shows everything brought together on an individual record. So you as a user, as a community partner user, what you would be able to do is some quick action buttons there at the top, communicate with this person via email. You can add a note to the record. You can create a referral for that individual. You can start the assessment. And again, that assessment will populate the social determinants of health. You can see here towards the bottom middle of the page, that information that we're sharing from our IEES system, our Integrated Eligibility and Enrollment System, where we do share some of the household information. You're able to identify the ages of that as well as the relationship. The reason this was important, again, as we went through our design, we talked with our community organizations, oftentimes if they're working with an individual, being able to have a more holistic view of their situation helped better provide the support and services. So just understanding kind of what their situation is at home, what that household composition is, even the ages, and being able to offer additional supports based on some of that information, our community partners thought would be very helpful. The enrolled programs, again, being able to display that enrollment, when that enrollment started. We've also included renewal dates. One of the things that our hope is our stakeholder users being able to see this. If there is an upcoming enrollment date, of course, as CHFS, we certainly make sure that they're notified, notices are sent. There's a variety of ways we do that outreach, but being able to see that, and if you're working with an individual and see that there is an upcoming renewal, maybe even being able to mention that to them to further check their next actions. So really being able to help people stay in coverage as long as best ways we can. I mentioned the assessments. And so here at the bottom left, you're able to determine the last date of an assessment was done, what the source of that is. So if that's going to be from the Kynect Resources Assessment, or if it's from the KHI system, then it's going to be indicated there, and being able to update if it's been maybe quite a while since an update has been made. Also with notes, being able to provide a way for community organizations and state agencies work across with other organizations, other agencies in sharing some relevant information. So let's just, as an example, with this is Estel Powell here, is you're sending a referral for maybe some employment training, being able to also add a note that, this organization may also provide, say, work boots, and being able just to add a note that that is an additional need that Estel may have, and being able to, again, give that receiving organization some more information, just a more holistic view. And so then I'm going to share I'm going to concentrate over here on the far right, where we have our referral activity, as well as our social determinant of health information populated. So being able to see what that referral history is for the individual. You can see here they have 2 new referrals. They don't have any in progress and none closed, but you can view that plan to see what that activity has been as necessary. Community partners can, and then also being able to just as a quick look, where is this person most in crisis? Where do they have some vulnerabilities? And then where do they have stability? Being able to build on that stability to help improve these other areas. Obviously, with the red, that's something that would need the most immediate attention. And using this information to help create referrals, help guide them through connecting to that help in a way that connects them quicker, certainly based on what their needs are, and being able to help improve their outcomes. And then just really quickly, our top 5 critical areas of need, what we're seeing based on the assessments in our system is our top 3 are housing, employment, and financial. And this is based on those assessments. So we continue to track those metrics and we share those out with our community partners as well as our leadership team. So within a community partner user or a state agency user, when I look at this workspace, I had shown you the inbox, but also wanted to mention that there is also a dashboard. We know that many organizations look at their reporting and they have certain things they need to report. So we built some information here. We did this with the input of other users and being able to, what would be helpful? So being able to see what's the most popular resource that is that my organization is offering and having a count of that. Being able to see the most referrals that are being made by each staff member and the most referrals closed by staff member. Being able to look at the number of referrals that have been sent. So if I'm an organization using Kynect resources, I can look at my dashboard and have a quick look at that activity for the month to be able to determine the number of sent referrals, how many have been closed. Also, who's referring to me the most and what organizations am I referring to the most? So being able to do that to really help, again, further integrate and impact those relationships between community organizations. If I know that I'm sending 50 referrals a month to one organization and being able to strengthen that relationship, as well as who am I referring to the most, and being able to use that information as far as you as an organization being able to strengthen those relationships too. And then just some other organization statistics with a rating, how many clients are being served, how many average days is it taking to close referrals, et cetera. So there's just some good metrics that we thought were helpful. But then also we as a cabinet certainly are tracking other metrics. So just wanted to share with the group quickly kind of what our referral activity looks like. You can see here, housing is by far the most requested or most referred category, with employment, financial, health, and food following. Health has definitely been one that we've seen grow over the recent months. And so that's an interesting trend to keep our eyes on. But other metrics looking at how many referrals have been created in the last 30 days. So it really kind of gives you an idea of the volume that we see as a system, where we've had over 2,400 referrals that have been created in the last 30 days. As far as referrals closed, we're a little smaller. We're at 185. We do continue our efforts to bring in more community organizations, and we have other ways to work towards getting those referrals responded to. We have about 337 community partners onboarded, as I mentioned, and those are 337 organizations. So there's oftentimes multiple staff members from a single organization who are using the system, but definitely look forward to continuing the trend of adding more organization users. And then as far as the assessments, we've had about 122 assessments that have been completed in the last 30 days. So it kind of gives you an idea of whether that's from a resident or a community organization, how that activity looks. And we continue to see these increase. And we think that, of course, in 2022, we'll see that just continue to rise. I do want to mention the onboarding process for Kynect resources. So there is a login, and because of the information that we're sharing, there is a process. And so first it is just finding your organization in Connect Resources. So we have, just as an example, worked with career centers. They are listed. And so what has to happen is an individual has to kind of claim that site indicating, yes, we want to activate our use of being able to log in. That is reviewed by our United Way partners. And then what happens, our system is going to send out a link. It is an email that says, welcome to Connect Resources. And there's a link there to be able to complete onboarding. So if you don't already have, if a user does not already have a Kentucky Online Gateway account, this is where that gets created. If they do, there's a specific link for that, and then they're taken directly to the training. So you can see here, step 3 is to complete the training. They're pretty brief. Certainly one, and number 1 is the privacy and security training. This is the same privacy and security training the state employees take. As we worked with our partners to develop this, the privacy and security was required because of the nature of the information we're sharing. We're giving access to information from our IES system as well as from our KHI partners. So we want to ensure it's being used appropriately. We also have a couple of brief trainings on the programs we're sharing information about, Medicaid, SNAP, TANF, and childcare, as well as just some basic navigation training. We do have onboarding supports available through quick reference guides and other materials, but certainly me as well. I have hosted onboarding webinars for offices, for individuals, or for groups of organizations as well. So certainly can help you, whatever your need is being able to have the login potential or that opportunity to be able to utilize the system. So that I am going to stop my share and I'm going to bring up a different screen. And while I'm doing that, I wanted to ask if anyone has questions or comments. No questions or comments. Okay, so how about this? Can everyone see this okay? Okay, I see head nods, so great. So this is a system demonstration just of, what it actually looks like to function and what it really means. So if I'm a resident or if I'm a community organization, if I'm a state agency and, someone says, hey, maybe I'm on this program, and that's great, but I'm really stuck on how I'm going to pay my rent. I can do a quick keyword search here and just type in the word rent. And of course, keyword searches are what they are. So the more specific you get, the more detailed results you'll receive. But wanted to be able to share what that looks like because, of course, there's a map, there's a list, and I'd shown you a screenshot of this, but certainly wanted to take a look at how someone may look at this information. So I come across a rent payment assistance program, and I'm able to see some additional details here. It looks like they're only offering the last $45 of rent payment. Maybe I'm looking for something a little more substantial. Scroll on down. This organization also offers that. It looks like it's a little bit more and may help me. I can call them directly. I can visit their website. I can go to their office. There are some details that organizations can provide specific to these resources to be able to determine, what are the office hours? What do I need to bring with me? So all of those details are there. If that person also then wants to connect directly, they could click the connect button and then they would have to use their login as a resident or community partner to be able to create an actual referral, which sends the information to that organization saying this person needs your help. Also just want to show quickly the categories that are available. So I can go in if maybe I only need, say, employment help. I can go in and search by those categories and subcategories as well, and it will bring up the same list, or the same format of a list, where I'm able to look through what is available to me. And lastly, I'm just going to show quickly the, we call it an archetype. So if I am unemployed, I can go directly into this unemployed tile. It's going to curate that list that I mentioned earlier, where it's going to be not just employment focused, but it may have things from different categories, health, food supports, but it is quite a long list. So you can see here that there's just some different topics that someone can peruse, go through. Still the same functions. You can see the WIOA program listed there as well. But then it goes on into some health supports as well as housing supports, et cetera. So just being able to look at how that works. Then I'm going to go ahead and see if it'll let me log in. I had a little bit of a glitch with my last presentation, and it's going to give that to me again. Okay, I'm going to stop sharing and see if I can get this to work. I don't know why that is happening here, but in the meantime, I am happy to take any questions that you all may have as far as Kynect resources, maybe some of its uses, how you would imagine that within the organizations that you work with, this may be beneficial, helpful, or any specific questions you have about function.
So Tracy, it does look like we have one question in the chat from Steve Rudolph.
Okay.
I believe this is a live tool, right? It's not in development.
Absolutely. So it is live now. We've been live for a while. One of the things that we've been doing is being able to add community partners. So we've had community organization events. We've, of course, with COVID, that really stopped us from doing a lot of our in-person that we had been doing and going around the state. But we do that in partnership with United Way as well, to be able to really bring the information about this to community partners. It's been very interesting because our residents have found their way. If you go to kynect.ky.gov, then, there's all kinds of things you're able to start from there, and Kynect Resources is one of that. So we really think that is, why, even though we really haven't done a lot of the outreach specific to residents, but they've still found their way here. So we're really excited about that. But we're really also hoping to see more of our state agencies throughout the Commonwealth find ways to integrate this into their workflows, also being able to find other organizations and bring them on board. And I am typing in the chat Kynect Resources website there. I'm going to try this one more time, and I apologize. I don't know. I do several demonstrations a week, and for some reason, it is really not letting me in today. And so if not, I'll just kind of go to the live site as we were looking at and see if there's any additional information that we can look at. I certainly wanted to share the Join as a Community Partner link that exists. Thank you.
So Tracy, while you're trying to bring that up, I will ask, you mentioned certainly several state and other, whether it's nonprofit, other resources that you all have brought on to the site for those to use. I know that you all have a touch point periodically to check on how those residents that have logged in and signed up for services, how they're being serviced. If you check in one time with, or I guess I should ask the frequency for one with your partners that you all check into, and then is there a number, whether it's 20 or 500, that you estimate of folks that are, in your network of resources using this tool?
So that's a really good question. As far as the number that are using, so when I talk about that 337, the 337 are the number of organizations who have joined Connect resources, and are active users. Does that help? And that doesn't mean though that, we can't necessarily capture the, number of how many community partners are just visiting the site to look up as a directory without using their login. We can look at what our website traffic is. Potential resident logins was around, I think it was over 70,000. Yeah, so I mean, it is significant as far as the number of residents. So right now we do see more resident users than we do our organizations. We really, our efforts have been to really bring some more information to organizations, state agencies, et cetera, to make sure that they're responding to those residents who are using the system. So that part has been, it was a surprise, like I said, but has been pretty significant.
Well, you definitely have some Kentucky Chamber folks on today. You certainly have members from the workforce development boards, partnering with the KCC locations on today. And then also the Office of Employer and Apprenticeship Services. I see several of their folks on today. So getting the word out, I'm sure they can assist with that.
Absolutely. And I know that, certainly like with vocational rehab, I think that there's at least one or two of the Kentucky Career Centers that have, claimed their site, added some staff as users. And so, certainly would like to see more adoption throughout the career centers and those other programs, and really being able to look at, just the way to integrate that into their workflow. I know nobody wants an additional username and password or workflow, but, there are several opportunities to really wholly serve somebody. Even like when I mentioned our Department for Community-Based Services, when they go through an application with someone and say that individual is just over eligibility, that doesn't mean they aren't without need. So maybe while they're not able to enroll them in one of our CHFS programs, they are able to at least maybe, once they have that information, find some other supports for them that may be outside of CHFS. And I would imagine with our career centers as well, where they may, even enroll them in programs just like DCBS may, but maybe I need something more immediate that could be supported from the community. I think our career centers are in that very similar situation.
Hey there, Tracy. It's Anna. How are you?
I'm very well. How are you, Anna?
Good, good. So the career centers, guess what? I'm on here, I'm listening, and I would love to plug that into our services that we provide. So please just connect with me. You and I can go and figure out the best way to get this information, all this great work that has been done, and make sure that we're sharing it throughout the Commonwealth. So I'm hearing you, and we'll make it happen.
Absolutely. And I really appreciate that, Anna. I know that we've had a couple of different conversations. And we also know that changing something, adding something to someone's process isn't always an immediate thing. But definitely looking forward to being able to plan some of those further conversations, being able to also be able to support that through some additional training, et cetera.
Well, just know I'm on board, and I will work with my team and you and try to figure out how to improve upon that process.
Okay, wonderful. Thank you so much.
And this is Denise Dials. I am the workforce director with the TENCO Workforce Development Board, and I agree with Anna. We're always looking for a resource directory for our staff and being able to take and make referrals more efficiently. And so, this is a great tool for us to be able to use. So I wanted to be on this call so I could learn more about, being able to claim my site or to be able to put my site out there, but as well as being able to see the different resources. We're in the sort of the northeastern part of the state. So, it's important for me to make sure that we have community partners that's also using this as a resource guide. And we definitely share this with our staff in our career centers in Tenco, and we'll continue to do so and really encourage the use of that for a resource directory. So thank you so much.
Thank you so much, Denise. That is fantastic. And I think that's exactly what we really want to see is, whenever I show in the dashboard earlier, who am I referring to the most, who am I receiving referrals from the most, using that information to really strengthen those community relationships and how we're working together as a community to kind of bring that together in one place so that can be strengthened. And then we do have additional users who are kind of using this as that one-stop shop, I guess, so to speak. So being able to have everyone together is just fantastic. So we appreciate any support, and certainly let me know if there's any additional supports I can be providing as well. So I know we only have about 20 minutes or so left. I just want to be able to show there is a referral inbox that when an organization receives these referrals, you can see quickly what that request is. I want to move the screen there. Being able to go into one and change the status. I can close that. I can assign it to a different staff member. If I close that, it's typically, and I click save, it's going to ask me for a reason. And if I see that it was not provided, it's going to ask me why. So, maybe the client canceled, maybe they didn't meet the eligibility criteria. Some organizations do have eligibility criteria, a variety of different reasons. The reason it's important is for us to be able to kind of use this information, share it with our community partners, and determine what's happening there. Certainly, we want to see those resources being provided. You can add comments there and submit. So that makes it go away. It goes from away from my inbox. I also have an outbox as a user to be able to look at what all referrals have I made out to another organization. I can track the status. I will say that you're not able to change that status because you've sent it to someone else. I mentioned that dashboard earlier, again, being able to provide users with some metrics that are specific to their organization. And what are the popular resources that are being offered or requested, etc. Also, I just want to point out the client search. So you can go in and search for a person that you're working with. It is required to have the first name, last name, date of birth to be able to search for them, to be able to bring them up. And I'm going to use, so the last person I had searched was Amy Brand. I added her to my client list. And then you can see from there, I'm able to see that one view screen that I had shared in the presentation where I can start an assessment. Again, this is a test environment, so it's taking a few minutes to load. But it's that one view screen that shows me what programs, what the family composition is, what the social determinant of health results are based on either assessment or the KHI integration. There we go. And you can see, because I've used this a lot in demonstrations, we've closed about 29 referrals. We've got 7 in progress and 2 new. You can see those results. And again, just information from what I had shared earlier. Users can create a favorite list. So I could have 15 in here or 5 or however many. Again, these are the ones that maybe I've used that dashboard and those organizations I'm most referred to and create a favorite list. That way, if I'm creating referrals, I can just use my favorites and I can click 3 or 4 of those rather than having to search them each time. There's also a way to edit your organization information here, being able to add different locations and being able to add different resources as well. So one thing we know, sometimes resources could be seasonal, and being able to, give me just a quick moment, being able to make them inactive if maybe they're only summer programs, but being able to edit those different resources, being able to add additional programs or resources for an organization. And then lastly, the staff. So being able to add all of my staff, being able to assign them to a location. And also if I need to make them inactive, I'm able to do that as well. We have two roles. You can either be an admin or a staff member. Admin, the difference is you're able to edit the resource and organization information and add other staff members. Staff members still have all the other functions, but they wouldn't be able to invite other staff or edit any of that information. And lastly, I am going to show, and no matter which Kynect page you're on, you can go to the very bottom. There is a link here. It says join as a community partner. And again, this is a test environment, so not all organizations may be listed here. But I'm going to go ahead. There is a video that walks through. It's about 6 minutes long. The step-by-step to get through the onboarding process. But I am going to just enter the word career here, see what happens. And so you can see here, and again, this is a test environment, so these may not even be real organizations, but it comes up, and if you find your organization, you would hit select, and they're going to ask for some basic information here. You're going to enter your information, what your role is. You're going to hit continue, and that actually sends that to our United Way partners to be able to confirm and be able to activate. And then what happens from there is that user would be able to receive that email to start their onboarding. Again, that includes getting a COG account set up if they don't already have one, or being able to go directly to the training if they do. So I'm going to go back again, and I am just going to go to a name we probably are all familiar with Goodwill Industries, because I just wanted to say, so if you see this, that means that's already been claimed. So if your organization indicates that it's already been claimed, and nobody knows who did that, I can certainly help you out in being able to get that facilitated. If somebody's already claimed that, but if not, click select. Let's say you can't find your organization, it's going to ask you to call 211 to be included in the directory. So just wanted to kind of point out, if you want to go and look for your organization, see if that comes up. If you do have any questions about if it's already claimed, maybe what are some next steps. I will tell you that we had several folks who had claimed their site, and then they really didn't do anything with that. They didn't complete it, everything. So we have worked with them one-on-one. We have worked with offices who maybe have several individuals. They've added several staff. And so we've been able to present to them to walk them through the onboarding process, or different groups. So, maybe there's several career centers, as maybe we work with Anna, that we may do a training session with. But that really concludes the basics of Kynect Resources, what the functions are. In its simplest form, it's a directory that is maintained between CHFS and United Way 211. We do a lot of outreach to be able to maintain this directory. Somebody can come in, keyword search, category search, just clicking into things and go and get the information they need and go, or being able to create that login and have access to all of those tools. So that really concludes what I have to share. And so, of course, I want to pause and find out what kind of questions all that generated. I know that was a lot of information. It's maybe a new concept even to some, as you think about how this may apply to the programs that you work with or direct. I certainly would love to hear your either feedback or your questions.
Hey, so Tracy, it's Anna again, speaking up, shocker to everybody I know. But at the end of the day, really, we need to get all of the career centers, their operators, like everybody involved, to try to make sure that we all have the same information, the same message. And I don't know, Denise or Corey or any of you, if you want to like chip in here on this, but I just want to make sure that no matter what the message is, it's completely uniform across the board, right?
Yeah, I totally agree, Anna. This is Corey Eimer. I'm the one-stop operator out of Northern Kentucky. We've been using Kynect. Well, it's been a process. You know, we initially got signed on in the fall, but to be very honest, we didn't start to effectively use it until a couple of months ago. But yeah, I think it's an excellent tool. As Tracy said, it offers a lot. And as I mentioned in the chat, I do feel like really any partner can kind of own it, but I think it makes sense for the operators to kind of take the lead in managing it, just because we have a sense of all of the different partnerships and organizations at our respective centers. So we can sort of play point person for navigating those resources for our local residents and citizens.
Yeah, and I think like Cora just like chimed in on the chat about Voc Rehab utilizing this service as well. I just like, sometimes I feel as much as we try to have these kinds of opportunities spread across the board, that maybe they don't necessarily stick. And so I would love to figure out like a work group with all of our different partners and everybody, so that we can try to figure out how to make it stick, and how to try to better take the opportunity to have this.
I think to that point too, Steve Rudolph put a comment in the chat. And Tracy, if you want to just check the chat out real quickly, but maybe some marketing opportunities out there. The use of, I know I put KY or kynect.ky.gov in the chat, and you had to add that / resources to get to that piece of it. So maybe some marketing opportunities out of this.
That's a good point. And so, I did see in the chat about going to Kynect and not necessarily seeing there. You do have to scroll down a little bit on the Kynect homepage. And of course, it's also a mobile friendly site. Being able to scroll down, you can see the health coverage, the Kynect benefits, as well as Kynect resources. So if I go from there, I can launch directly over. Maybe if I forget to do the / resources to be able to get to that homepage. And so I just wanted to show that really quickly as well. I appreciate what Corey and Anna had discussed. And I really think part of it too is, that training, that ethos of how can I help this whole person? I know that we're focused on, within our DCBS offices, maybe the programs that we offer, and being able to, always be on that lookout for how else I can help that may be outside, based on the conversations I'm having with individuals I'm working with. I think with the career centers, Voc Rehab, different ones, being able to hear that and knowing that this is a tool that can help you achieve that, as far as being able to respond in a holistic way, or even to help supplement what you're offering. Or maybe there's other programs within that world that are other state agencies, and being able to use this to connect that individual there and have that correspondence with that other organization as well.
Any other questions for Ms. Tracy?
And what I could do, I know that somebody had also asked for contact information and the links. I could certainly send out the presentation that I shared today along with that information as well, so that everybody has that.
And if you'd like, just send that to me and I can put it on our K website. I did also put that in the chat. Each of our monthly partner spotlights we record, and for presentation materials and things like that, we include that as well on the K website. So
perfect. Okay, great. Yeah, I will get that sent over to you. And then I just want to also add, if there's questions after you've thought about this, maybe, you know, another idea comes up, maybe there's some supports you need, please don't hesitate to reach out to me. I really look forward to being able to bring this to more and more people. And I really appreciate you all letting me be here and share this with you today.
Excellent information, Tracy, and we appreciate you agreeing to it, certainly. This platform is for folks on this call and the rest of the folks we send this invitation to. So if there's something you want to hear more about, if you want to check out our past monthly recordings, as I mentioned, do reach out to me and I can get you information on upcoming opportunities. But Tracy, thank you and CHFS and United Way for bringing this resource to us all.
Absolutely.
And we'll
Thank
give
you.
you 4 minutes back of your lunch.
Great.
Take
Thank you,
care, everyone.
Thank you.